Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we got Jesse in here with us this morning. And Jesse is my most interesting case this week. Jesse has been through the medical mill of testing and procedures. And well, why don't you just tell them, Jesse? Come better from you. Tell them what they diagnosed you with initially, too.
Well, I basically had a headache one day at work and drove my truck straight to the ER, and they told me I was having a heart attack. So I
They got you right in. You drove into Methodist Hospital, too, right?
To Methodist ER.
I
went to Methodist ER with my delivery truck and
That's
thought I was
probably the
having a
most-
heart attack. Yep.
unique delivery they've ever received.
Yep. So I went the cardiac route. They didn't think it was a headache. They thought that something was wrong with my heart. When that all checked out, and my cardiologist had a GI friend, and he said, maybe we should get he recommended get my gallbladder removed. He said I'd probably feel better. So,
Yeah, it was only working at 40%, huh? So we'll take the whole thing out and work at 0%.
so I had that removed, but the headaches continued, and they got worse. And then I got diagnosed with cluster headache, which is like the worst pain that you could have, on the side of your head.
And tell them what diagnostic test you went through to come to that conclusion.
So I've had lots of MRIs over about the time span of like 8 years, and my last diagnostic test was a brain
Angiogram.
angiogram, and because they thought that I had a blocked artery in my neck.
Well, and in your brain too.
And in my brain.
Yeah.
But unfortunately, when I woke up from that exam, I was completely numb on my right side, and the headaches still continued after that, and I'm here.
Yeah, kind of as the last resort, huh? You've kind of already been through the whole medical mill of testing and
Yes, sir. Yes,
drugs. I mean, you've been off all these different drugs in the past too.
Yes, sir.
And none of that's really helped your headaches,
Oh, yeah.
what they're calling cluster headaches.
Yeah, I have a whole cart at home full of all the medicines that the doctors are giving. I could probably fill 3 big Tupperwares full of
Yes,
all
Shadow's trying to copy all those right now.
all the neurological medicines that they've given me that I've tried and they don't work. But each one of those medicines are 3 months out of your life. So just do the math on.
Well, Jesse is the most prepared patient with a severe condition that's ever come into this office. He brought all of his medical records, all of his diagnostic tests, all of the diagnostic test results. And one of the main things that we rule out to make sure that it's safe to do these adjusting procedures on our patients is a condition known as atherosclerosis, which is a plaquing and a narrowing of the arteries, the disease of the arterial system in the human body that can lead to a potential stroke if you get a vertebral or carotid artery dissection. So we rule those things out. It just so happened he brought in ultrasound tests of the carotid and vertebral arteries, and they're all clean.
Yep, all clean.
Completely clean.
Yep, they never find anything wrong.
And we did a pretty thorough history and exam on you today too to rule out those things, didn't we, Jesse?
That's right.
I mean, you made a comment to me during the examination, during the history, that this was more thorough than what the neurologist had done on you before they stuck those wires and stuff and dyes in your brain.
Mm-hmm.
And they're still wanting to do more medical procedures. They want to do it, what was that?
Now they
Exploratory?
Want to give me,
Exploratory brain surgery now, right?
basically they want to give me the same test that ended up with this numbness and tingling, the same MRI with the same dye
with
that,
contrast.
that they used to light up my brain that I had a reaction to. They they wanted me to do the same thing.
Right. And it didn't work out so well the first time, so they want to do it again, right?
Yeah.
So anyway, Jesse's coming here as a last resort. We have ruled out any contraindications to receiving these procedures, so this is going to be a great case to follow because Jesse's, he's been through, how long has this been going on now? For years, right?
Oh, for years. This is like 10 years now.
Yeah, you've been dealing with these headaches severe, and they're getting worse too, right?
They're getting worse.
Over time. So we've done his history and examination, and in my examination, he definitely has subluxations of his cervical spine, occipital atlanto subluxations, which is right where his skull meets his first vertebra in the cervical spine, and that most often is the cause of what we call cervicogenic headaches, meaning emanating from the cervical spine. And that's how I'm going to be treating him today, moving forward with that provisional diagnosis. So this being his first adjustment, we're gonna lay him face down on this table. Let's put your glasses over here though, Jesse, so I don't break those. I do a lot better with backs than I do broken glasses. I'm gonna go face down again. Now his left leg's an inch shorter than his right leg. Bring it up, it gets even, and that tightens up and you low back quite a bit, doesn't it, Jesse?
Oh, yeah.
See how his pelvis raised up off the table, so he's got a positive Deerfield on the left and a positive Nautilus lumbosacral pain. So we're gonna start off adjusting his left sacroiliac joint. Some of these might be a little tender at first, Jesse, just because they've been out for a while. They'll feel better once I adjust you. Yep. Yes, sir. Yes, sir. Keep breathing. He's had a lot of problems down in this lower thoracic region, which I just got to do great. Looky there. It's exactly even. Jesse, tell me if this feels easier this time.
Better.
See, the pelvis didn't raise up as much that time either. You're gonna feel your head popping up on this next one.
Okay.
Very good. Okay, let's turn you on your back, please. A little deeper in person, huh?
Oh, yeah.
There we go. Scoot you over in the center here just a little bit. Okay, I'm gonna bring your whole head up and over your spine. Yep. Now, slide down about an inch and put both arms straight out to the side for me. Hands pointing towards the ceiling. Adjust your shoulders, your clavicles, anterior ribs. Very good. Okay, you can relax your hands right there now. Let this right leg go like a limp rag for me. There we go.
Oh, yeah.
You should have felt that from your knee all the way up to your lower back.
Oh, yeah.
Very good. All right, let's set you up, face that way again. And start keeping your chin up. I know you have a tendency to drop that head down. That's everybody pretty much. We give all of our patients homework assignments on their posture, home exercises, mirror image exercises, sleeping correctly, walking fast, and creating a crossover in the neurology from the brain to the body. Yep. And you might ask, what does popping his elbow and his fingers have to do with his headache? We're creating a neurological feedback into the brain with afferent neurological impulses that change the brain physiology. And our goal is to override that bad adaptation that you've had for years with a newer, better adaptation. Let's come on this table. You can say what you want to about the ring dinger, but I've seen more miracles happen with this adjustment than any other chiropractic technique I've ever used in my 42 plus years of practice. If I had but one adjustment to give, it would be this one. Slide down just a little bit. I want to raise your legs up first. Just let them relax. So this is how I recommend you sleep, on your back with no pillow, because when you put that pillow on there, guess what that causes? What was in your report? Straightening of the cervical lordosis. You want to get rid of that. Have your legs up like this, parallel. That should feel pretty relaxed.
Yeah.
Except for when I pin this pin in there. No, don't tilt.
Okay.
I'll get it in sideways.
All right.
It's gonna feel tight, and it should. You're not going to get away now.
Oh, man.
Yep. This one, Jesse, just keep your teeth together. Don't bite your tongue. Breathe through your nose. Deep breath. Yes, sirree. Now, Jesse, you should have put that one all the way down. I'm pretty sure you did.
Oh yeah.
And looky there, you're still kicking. Tilt left just a tad. Tilt right. Yes, sir. I will be very surprised if that doesn't help your headaches. Not as bad as it looks, is it?
Oh no.
Here, let me help you up sideways. You always want to turn sideways when you get up like that. Let's come over here and stand in front of the mirror. You should feel a little lighter already.
Man, I feel taller.
Yeah, you are. See how your head's not tilted off to the right so badly?
Mm-hmm.
Look here, we even that space out here in your pelvis too.
That's right.
Okay, here's your homework. Shoulders up and back. Put these guys like that. You're gonna bring that head straight back, then look back. You'll feel a little tap on your atlas there. And there, now relax. Go forward and backwards again, Jesse, and tell me if this feels any different this time.
Oh yeah.
Should feel a little smoother.
It feels way smoother.
Cool. Take a look at your posture now. You
Oh,
squared off like a military man.
Oh yeah. Yeah.
Well, Jesse, how would you describe your first experience here at Advanced Chiropractic Relief to the people watching this?
It's definitely a relief. It's definitely. I was kind of apprehensive at first because I've been through the ringer.
And they probably told you don't go to a chiropractor.
No pun intended.
Right.
I've been through the ringer, with traditional Western medicine, and I haven't had any results. So
Yeah.
basically, I'm desperate.
And I like desperate, last chance types of cases. And we are accepting severe cases like Jesse in here because often they don't have anywhere else to turn. And, some chiropractors are afraid to touch his kind of case, but Tristan and I are not. We take care of some of the most severe cases that are on the planet, really. And that's one of the reasons you came here, isn't it?
Oh, yeah.
You had seen that on our YouTube videos?
Oh yes, I've been watching you for years.
Oh, that makes you a crack addict,
Yeah. So that's why it gave me that adjustment. I was like, oh, the crack addicts are gonna like that.
Yeah. Did you feel that all the way down?
I did.
Well, if you felt that all the way down, go ring dinger bell. That's a real deal too. That's our freedom bell, freedom from pain.
Wow.
Here, come sit in here. Well, first of all, I want to commend Jesse on his bravery of getting in here and letting us do an examination, history on him, and try to help him with the underlying cause of what we believe is causing his headaches. And I think that's emanating from your cervical spine, meaning cervicogenic headaches. All these medical diagnoses haven't really rendered you any relief with all their testing and invasive procedures that they've done on you.
Yeah.
In fact, you've had issues and complications from those invasive procedures, right?
I have.
Because can you feel your whole right side? You told me after they'd done that brain ultrasound, or not ultrasound, but angiography on you. So, chiropractic is non-invasive. We're not putting anything into the body or taking anything out of the body. We're only enhancing the body's ability to function at its most optimum potential because we're reconnecting the brain to the body, helping with homeostasis and normal neurophysiology. Good. Well, thank you for sharing your experience with everyone.
Thank you for having me.
He's going to be an interesting case to follow, so keep tuned. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Jesse also from Houston, Texas. We'll see y'all soon.
All right, thank you.